Hello guys, welcome back to my channel. It's your favorite esthetician again. If you're new here, welcome. My name is Amaka and today we're talking about a very interesting, topic, and that is glutathione. Whether or not I would recommend it, the types of the different ways you can take it, orally, through drips, what do you call it, topically, through creams, everything. In fact, the pros, the cons, advantages, side effects, everything. If you're interested in knowing all about glutathione, then please keep on watching. So, what is glutathione? First of all, this ingredient is everywhere, as in it has been marketed and raved about as a skin whitener. If you have not taken a glutathione drip, you're not serious, you're not ready, you've not started your whitening journey. Why you want to whiten is another conversation, but let's focus on why we are here. So before I talk on glutathione for skin whitening, I will just touch on what it really is. Glutathione is an antioxidant, a very powerful antioxidant. And I've done a video on antioxidants and how and why they are very important. So our skin has glutathione, and what they do in the skin is fight free radicals. So free radicals are our number one enemy, and they are everywhere, like the air we breathe, sun exposure, inside our system. They are everywhere, and they are the primary cause of premature aging. They lead to inflammation, hyperpigmentation, different things, cancer. Free radicals are just the worst. And what antioxidants do is neutralize them. So our body has their own antioxidants that neutralizes these free radicals. Obviously, you need help from our skincare product, but we have our antioxidants in our body. And glutathione is one of the most potent ones. Obviously, as we age, as we get wiser, it depletes, so it needs help to remain effective. And the way to boost your glutathione level for this purpose is not by taking drips, my sister. It's by your diet, eating foods and fruits that are rich in vitamin C, selenium, and one other thing, sulfur. So things like your kale, your cabbage, your cauliflower, your sardines, your broccoli, those sort of foods can help you boost your glutathione level. So that is the gist about glutathione, honestly speaking. So let's now talk about it and brightening and lightening, as in how they have portrayed it to be. So there are three possible ways that glutathione can help in brightening the skin. The first way is by its antioxidant activities. There's something called post-inflammatory hyperpigmentation as a result of an inflammation. So by putting your free radicals in check, they will prevent the inflammation that can be caused by these free radicals, and then prevent the hyperpigmentation that can be caused by this inflammation. So it's more like a preventive measure. Do you understand? To prevent hyperpigmentation. So that's one way glutathione can help your skin appear brighter. Another way that glutathione can help brighten the skin is by very mildly reducing or inhibiting tyrosinase activity. So I've talked about this enzyme in a lot of my videos. So tyrosinase is the enzyme that produces melanin. Also, glutathione can convert eomelanin to pheomelanin. So there are two types of melanin in our skin, everybody's skin. There's eomelanin and there's pheomelanin. Eomelanin is the brown to dark pigment melanin, and pheomelanin produces is the yellow, red to pink pigment. Now the ratio of both of them in your skin will determine your skin color. So if you are darker, it means you have more of the darker melanin, and if you are lighter, you have more of the lighter melanin. So glutathione can very mildly convert the darker melanin to the lighter one, and then you look lighter. It sounds good, right? Okay, let's delve into how effective it is in actually doing these things and the ways we can get glutathione to do these things. There are three major ways people use glutathione for skin lightening. Topically, so they apply it as creams; orally, so they take supplements; and intravenously, IV, through drips straight into the bloodstream. Now, wow, now real wow. Anyway, let's look at the pros, the cons, and the studies behind each of these types or each of these sources of glutathione. Now, the first one is topically, so through your creams, serums, anything you apply on your skin. Now, the advantages of using it through this type is that it has been approved by the FDA. So the FDA is a body in the US that governs cosmetics, food, and drugs. So using glutathione topically has been approved as safe. It is safe to be used, so it has minimal side effects. So that is the advantage. Now, the disadvantage is that firstly, it is not really effective. There are a lot more effective tyrosine inhibitors than glutathione. The effect is very, very, very minimal. Even look at products that you use that they have plastered glutathione on the body and are effective. Look at the ingredient list. There are other lightening ingredients in that product that actually getting the job done and not the glutathione. So that's number one, not so effective. Secondly, the molecules of glutathione are significantly big, so they have a hard time getting into the skin and actually working. Thirdly, there are little or no studies showing the efficacy of glutathione. Like, to the best of my knowledge, there's just one study available that was conducted amongst 30 Filipino women, and they divided their face into two. Rather, they applied two different creams on two sides of their face. One side had a 2% glutathione cream, and the other side had a placebo cream, so had a plain cream. And after a duration of like 10 weeks, they observed both sides and they realized some mild lightening on the side with the glutathione. But then again, the number of people that did this study were just very few, 30 Filipino women, and just within a period of 10 weeks. So there was no follow-up, there was nothing. So this study doesn't really show us anything. Do you understand? And even from the study, the effect was really mild. Even from what people see in real life settings, the effect is really mild, really, really like almost insignificant when used on its own. Now, the next one is orally, so taking glutathione supplements. And the advantage of this is very similar to topical application, is that it is relatively safe. It has been approved by the FDA as relatively safe. The disadvantage is also very, very similar to the topical one, which is one, the effect is really minimal. And that's because when you take it orally, it's not really bioavailable. So when you say something is bioavailable or bioactive, it means it contains molecules or ingredients that can affect our skin cells. When you take it orally, it's being broken down by our digestive system, and there's little to nothing left to actually get into the skin and reduce the activities of tyrosinase. Secondly, I think there are just two studies available which are substantially really flawed because there were no control groups, and when conducting a research, there are usually control groups and experimental groups. Now, so the experimental groups are the people that they apply the thing that they want to test, and the control groups are the people that they don't apply anything to. So when they, after a period of time, they now compare both individuals to see if there is a change. There was no control group, so there was nobody they were even comparing their experimental group with. Even amongst the people that they did this experiment on, they showed very minimal skin brightening. So it's very similar to the topical application. Safe, relatively safe, no severe side effects, but not as effective, and with very minimal studies. So because of this, because it is hard to get it to work orally and topically, people have decided to take it intravenously. That is how this whole thing started. Is they want to ensure that they get this glutathione into the system by fire and by force, and then they've taken it intravenously through the veins by using drips and straight into the bloodstream. Now, I must point out that taking glutathione intravenously through drips is not new. It's actually a very old practice, very, very old, but were only used by doctors to treat certain diseases. First of all, they use it for people undergoing chemotherapy to flush out the system and prevent toxicity from the chemotherapy. It's also used for liver disease and Alzheimer's disease. So it's a medical procedure. It's a procedure done in the hospital, for want of a better word. Now you see it in a lot of spas. People are using it on the gram. See people with drip and filter, just catching up on one thing. Yeah, taking my daily dose of glutathione. Okay, let's look at it now. Let's see how effective it is at skin brightening and whether or not you should be using it. Most of the people that do this back this up or claim that, one, it is the most effective way of getting glutathione into the system. They have decided that if it's not glutathione, there's no other thing that can flush your system. There's no other thing again that can brighten your skin. It has to be glutathione and it has to pass through your veins into your system. They also claim that it can give you instant whitening and brightening. The issue with this is that it's not substantiated. There's absolutely no study, none whatsoever, studying glutathione as a whitening agent when taken intravenously. Do you understand? No studies. I think I watched one video where someone said that there has been one study. I couldn't even find the study, and even in that study, it shows minimal effects. Even though there's one study safe, I want you to think about it critically. There is no study, or there's one study that has been done on something, and that study has shown very minimal effects, and you've chosen to take that thing that has no study or has just one study and inject it straight into your bloodstream. Like, how does that make sense? Make it make sense to me. In fact, let's take a minute of silence for all those who have decided to venture on this mission. No judgment. I understand that some of you don't know these things, and that's why I'm here to, teach, to shed light, not teach, to shed light on these issues. Do you understand? And honestly speaking, it's not new for cosmetics companies and brands and manufacturers to use ingredients in their formulations that have little or no studies. It is okay. I mean, what's the worst that will happen is that it will not work, no honey. You rub it, no study, it did not work. Or pata, you have dermatitis, and you stop now. You move on with life. So it is okay if there are no studies surrounding something that will be applied topically. It is risky to inject something into your bloodstream that has no study. So you don't know what you are up against. You don't know. And the second thing is there are no regulations. So there are no regulations or guidelines as to dose, quality, or source. I'm not sure you understand what this means. Now, okay, let me bring it home so you can understand it. Can you imagine a world where there was no regulation as it relates to the drugs that you take? Drugs safe, it will go down and to digest. This one is not digesting, it's going straight into the bloodstream. Imagine if paracetamol, there was no regulation. You don't know whether to take 2 or 3 or 4. Me and you would have died, because that's how you take 5. Me, I'll take 10. Someone take 15. Someone take 3. Someone take 5. It's because there's a regulation, because there has been studies, and that's why they can tell us, okay, take 2. Do you understand? Imagine where there was no dose for anti-malaria medication. You just be taking like 20, 30. Nobody knows. And you have decided to inject this thing into your system. Everybody is just doing what they want. There is no guidelines. It is a risky thing. Salicylic acid, we know that we should not go above 2%. And at 2%, it does the job. At 10% to burn your skin. And I'm taking my time to explain this thing because you need to understand what you are actually doing. Like, I mean, anyway, the third disadvantage is that it has minimal effect. So yeah, I don't understand. So you're using something that has no studies, has minimal effects, has no regulation and guidelines, and you are injecting it into your bloodstream. Make it make sense. See, I know it may seem like I'm scolding you, but if scolding you will make you stop it, or will make you not do it if you're planning on doing it, or will make you stop performing this procedure if you're the owner of a spa, if scolding you would make you not do either of these things, then I will scold. I will scold you. Anyway, let's continue because there are still many left though. I'm not done with you yet. So yeah, also lack of proper training. As I explained, like this taking glutathione intravenously has been around for years and done by doctors. Now people in spas are doing this, estheticians are doing this, spa owners, trainees, and you are not properly trained. If you must do it, it must be under the supervision of a dermatologist. Even esthetician don't agree. Go to a dermatologist if you must do it, which I totally and completely 100% disapprove of. Not like I'm anybody, but if you are here, you want to know my opinion, and I'm giving it to you. I totally and completely disapprove of. Wait. Let me add. The one that offed me. So when I went on YouTube to research on glutathione and how people are using it, some people were even teaching people how to do it themselves. So you want to now go and buy a drip and inject yourself because you want to be white. Anyway, lastly and most importantly, there has now been a lot of adverse effects, side effects that has been recorded from this procedure. I was not even surprised, Seth. Are you surprised? Why are you surprised? What did you expect when you decided to inject something that had no studies, has no regulation, like has minimal effect? You decided to carry it and put it inside your blood. As in, why are you surprised that there is now adverse effects? Anyway, let me read out some of them to you. It's not me that said it, it's on the internet. Now, some of the side effects include liver failure, kidney failure, sepsis, which is a life-threatening infection, abdominal pain, serious skin diseases. There's something called the Stevens-Johnson syndrome, which you have blisters, your skin is peeling off and scaling off. No, scaling is good. Removing, your skin barrier is literally falling out. Do you understand? And that Stevens-Johnson syndrome is usually an adverse drug effect reaction. When you adversely react to a drug. I remember even in one article I read, I read that 30% of the people that were given glutathione in a particular center in the Philippines had one or two of these side effects. You can imagine. Anyway, just Google. Google is your friend. Google. Okay. Let me check if I've covered everything because this matter I don't understand. In summary, glutathione is an antioxidant. It's very potent. It helps neutralize free radicals and it's in our body. If you want to boost glutathione levels, take foods and fruits that are rich in sulfur, selenium, and vitamin C. Now, glutathione for skin lightening has very minimal effect. It is not one of those top key tyrosinase inhibitors, but in combination with other tyrosinase inhibitor, it's a good thing to have. Do you understand? So if you want to add glutathione in your routine, I would advise you keep it topically. Just buy creams that contain it. If you want to do orally, it's okay as well. It has been approved as safe. I don't know why you're doing that, but if you want to do it, that's fine as well. Never, ever, 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 ever take glutathione drips. Do not take it. Do not take it. Anyway, I really hope I got through to somebody. One person is fine. One person, because I may just have saved your life. Anyway, thank you guys so much for watching. Don't forget to share, like, subscribe. If you have anybody that takes this thing, send this video to them. I know that most of them are coconut head. They will not agree, but send it. Satisfy your conscience and send it to them. Anyway, thank you guys so much for watching, and I'll see you in my next video. Bye, guys. My sister. What is it now? Hello?
Morning.
Good morning.
Okay, I sent a message on WhatsApp that can an ATM use a mattress sunscreen.
Yeah, they can.
Okay.